lecture is an introduction to drug receptor interactions. Some common terms related to drug receptor interactions such as agonist, partial agonist, antagonist and inverse agonist with various examples will be discussed. Two-state and three-state receptor model will also be explained. To start, how do drugs act? A scientist, Paul Ehrlich, insisted that the drug action is due to chemical interaction between the drug and the tissues so that the function of these tissues is altered. So the drug molecule gets so close to the cellular component that the two interact chemically through binding sites referred to as drug targets. Most drug targets are protein molecules with few exceptions. The exceptions are antimicrobial and anti-tumor drugs interact with DNA rather than proteins. The second exception, bisphosphonates useful for the treatment of osteoporosis binds to calcium salts in the bone matrix, rendering it toxic to osteoclasts. This reduces the loss of bone due to osteoclasts and helps in maintaining bone and useful for the treatment of osteoporosis. 4 kinds of regulatory proteins are involved as primary drug targets. These are receptors, enzymes, transporters, and ion channels. So what is a receptor? A receptor is a target molecule to which the drug molecule binds and produces a pharmacological response. It serves as a recognition site for the drug molecule. For example, adrenaline, which acts as an agonist, binds to beta-adrenergic receptor and a train of reactions is initiated, and this gives rise to increase in heartbeat, increased force of contraction. While in the absence of adrenaline, the receptors are functionally silent. So generally the receptors are functionally silent in the absence of a ligand. But when the ligand binds to the receptor is activated and produces a pharmacological response. Thus, the drug binds with the receptor and produces a pharmacological effect. The drug effect is attributed to the following 2 factors, affinity and intrinsic activity. Affinity is defined as capability of a drug to bind to the receptor and form a drug-receptor complex. Intrinsic activity or efficacy can be defined as ability of the drug to trigger the pharmacological response after making the drug-receptor complex. On the basis of affinity and efficacy, drugs can be broadly classified as agonist, partial agonist, antagonist, and inverse agonist. What is agonist? Agonist, sometimes called full agonist, is a molecular chemical compound that can bind to a receptor, that is, it has affinity and activates the receptor and produces a biological response, which means that it has intrinsic activity or positive efficacy. So both affinity and intrinsic activity is 1. Example, morphine stimulates the opioid receptors and acts as an agonist. Next, what is partial agonist? Partial agonist is a molecular chemical compound that can bind to a receptor, that is, it has affinity which is equal to 1 and weakly activates the receptor, thus producing a sub-maximal biological response. So for the partial agonist, the affinity is 1, but the intrinsic activity is less than 1 because it fails to produce full therapeutic response even at higher concentration, unlike agonist which produces full therapeutic response or maximal response. A key point to remember is that the partial agonist binds to the agonist binding site and behaves as a competitive antagonist and prevents the binding of agonist to the receptor. Examples of partial agonist are 1. Use of morphine versus buprenorphine for pain management. Morphine acts as an agonist and stimulates the opioid receptors and produces analgesic action. However, excessive stimulation of the opioid receptors results in respiratory depression as a side effect. Buprenorphine, a partial agonist of mu opioid receptors, partially stimulates the opioid receptors and produces analgesic action. The advantage of buprenorphine is that it is a safer analgesic drug than morphine because it produces less respiratory depression in overdose because it's a partial agonist and it fails to produce full therapeutic response even at high concentration. The next example. Typical antipsychotics versus aripiprazole for the treatment of schizophrenia, a psychiatric disorder. Schizophrenia is characterized by excessive dopaminergic activity. Typical antipsychotics are useful for the treatment of schizophrenia by antagonizing the dopaminergic receptors or more specifically the D2 receptors and treats positive symptoms of schizophrenia. However, complete blockade of D2 receptors can result in extrapyramidal side effects which is undesirable. Aripiprazole, a newer atypical antipsychotic drug, is a partial agonist at D2 receptor. Being a partial agonist at D2 receptor, it binds to the agonist binding site and does not allow dopamine to bind to the active site of the receptor and hence treats the symptoms of schizophrenia. But because it acts as a partial agonist and partially stimulates the dopamine receptors, the incidence of extrapyramidal side effects is less. Aripiprazole has a favorable side effect profile. Next, what is antagonist? Antagonist is a molecule or chemical compound that can bind to a receptor, that is, it has affinity but unable to activate the receptor, thus produce no biological response. So the efficacy is 0 in case of antagonist. Intrinsic activity and efficacy is 0 and affinity is +1. Example of antagonist is atropine blocks the action of acetylcholine in muscarinic acetylcholine receptor, and here atropine is an antagonist and has 0 intrinsic activity or the efficacy is 0. Next, what is inverse agonist? With respect to inverse agonist, there is a term known as constitutive activity of the receptor. It is defined as ligand-independent receptor activation. This means that a proportion of the receptor population undergoes spontaneous change in the conformation in the absence of an agonist, and this leads to activation of G protein mediated signaling pathways and producing a biological response. For example, the receptors for benzodiazepine, opiates, serotonin, cannabinoids, histamine show activity even when not occupied by an agonist. That is, they have constitutive activity independent of ligand activation. So, inverse agonist binds with the constitutively active receptor, stabilizes them and reduces the activity. Inverse agonist does not simply block the receptor but further inactivates the receptor activity beyond its baseline value. So, the intrinsic activity is negative, the efficacy is negative. Another key point about inverse agonist is that it is a molecular chemical compound that can bind to the same receptor site as an agonist and produces a biological response opposite to that of an agonist. For benzodiazepine receptor, benzodiazepine is an agonist and acts on benzodiazepine receptor and causes sedation, anxiolysis and muscle relaxation. Whereas beta-carboline, which acts as an inverse agonist, produces effects opposite to that of an agonist and causes CNS stimulation, anxiety, increased muscle tone and convulsions. Other examples of receptors that have constitutive activity and drugs that acting as inverse agonists on these receptors are 1. The beta-adrenoreceptor, and the drugs acting on these receptors are metoprolol, carvedilol, propranolol, nebivolol and bisoprolol. For histaminergic receptors, that is for H1 receptor, cetirizine and loratadine acts as inverse agonists, and for H2 receptor, ranitidine and famotidine acts as an inverse agonist. For angiotensin receptors, losartan, candesartan, olmesartan act as inverse agonists. For D2 receptors, haloperidol is an inverse agonist. The drug-receptor interactions can be explained by two-state and three-state receptor model. According to the two-state receptor hypothesis, the receptors for the agonist exist in two conformational states, the inactive state of the receptor, that is Ri, and the active state of the receptor, that is Ra, and they are in equilibrium with each other. In the absence of a ligand, most of the receptors are in the resting state or quiescent state. So the equilibrium is shifted towards the left, that is the inactive state of the receptor. Only few receptors are present in the active state. An agonist has higher affinity or greater preference for the inactive state of the receptor than the active state, and after binding to the receptor is activated. That is, the inactive state of the receptor gets converted to the active state and the equilibrium is shifted to the right, that is, greater number of inactive receptors become activated. So this results in positive efficacy. A competitive antagonist has equal affinity for inactive and active states of the receptor, and the prevailing equilibrium is not disturbed. There is no conversion to the active state and efficacy is 0. Next is inverse agonist. The interaction between inverse agonist and the receptor is explained by a three-state receptor model. According to the three-state receptor model, there is a third state of the receptor where the receptor shows constitutive activity or spontaneous activity of the receptor. The inverse agonist binds to the constitutively activated receptor and reduces the spontaneous activity and converts the receptor to inactive state. It can further reduce the activity of the receptor below the baseline level, so the intrinsic activity or efficacy is negative. So in this way, the drug interactions can be explained by a two-state and three-state receptor model. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.